Good morning, good afternoon, good evening. You are listening to the Thai Expat Daily Show. I'm your host, Kieran Mack. Don't forget to like this video and subscribe, and let's just jump into today. CAAT updates requirements for domestic flight passengers to Phuket. The Civil Aviation Authority of Thailand has updated its requirements for people boarding domestic flights to Phuket so that passengers can now present test results proving the passenger is not infected with COVID-19, issued up to 7 days before the passenger boards the plane. The revised order was issued by CAAT late last night. The order came into effect today, June 1st. As with the previous order, the CAAT maintained that flight passengers travelling to Phuket must be fully vaccinated or have tested negative for COVID-19 in order to board a flight to Phuket. However, test results may now be issued up to 7 days before the passenger travels instead of 72 hours. The CAAT's latest order also recognised that passengers previously discharged from medical care for COVID-19 must have been discharged at least 90 days before travelling and not exhibited any signs of infection since, or they will not be allowed to board the plane. Passengers must be fully vaccinated with the number of doses required by each vaccine, or 1 dose of AstraZeneca, or those who are infected and already received treatment within 90 days, or those who are tested RT-PCR or rapid antigen test within 7 days prior to the journey and have a negative test result, the order said. Airline passengers will be refused travel to Phuket if their vaccination is incomplete or they do not have a test document for COVID-19, the order warned. The vaccination and test requirements do not apply to young children. Passengers who are unable to present documents will be denied travel by the airline, except children who are younger than 5 years old, the order said. The option to quarantine in Phuket is available to those who arrive via road. Meanwhile, all flight passengers travelling to Phuket, like any other domestic arrival, must install the More Chana app and enable location sharing for the entire duration of their stay on the island. All flight passengers must register their travel details through the www.gophuket.com website. Travellers were advised to self-monitor for signs of infection. Now, this is just in relation to domestic travel within Thailand. So it's basically narrowing it down to you need to either have 2 doses of SINOVAC, 1 dose of AstraZeneca. I presume the reason why they're saying 1 dose of AstraZeneca is because there's 4 months between the first and the second jab. It's the only reason I could see it being that way. You need to either, if you don't have either of them, you need to be able to show a PCR test or a rapid antigen test. No older than 7 days, but it was 72 hours before. Now it's a week. I mean, that's kind of a bit odd too. I mean, you could easily get COVID within a week. You know, if you got your test on Monday and flew on a Sunday, you could definitely pick up COVID. But still, it's odd. Or if you've actually had COVID and you've recovered, and obviously you'd have some kind of document showing that you spent your time in hospital, and it has to be within 90 days of that. So they're the new rules if you wish to fly into Phuket. Again, the same thing is if you're coming in by road at the Tatachai checkpoint. And don't forget that they don't have any testing stations there anymore, so you need to be tested before you come. For anybody who is coming and you've suddenly forgotten your test result, Panya Hospital offer rapid antigen testing by appointment only, and the cost, I think, is about 500 Thai baht. Or Takupa Hospital in Panya also offer rapid antigen testing. The price there is 945 baht. If you go before 10 o'clock, you will have your results by 1 o'clock. And if you go after 1 o'clock, it'll be 4 or 5 in the evening by the time you get your results. So turn up early is the name of the game there. Just for anybody who is thinking of going there, I went there at 10 in the morning, or 9 in the morning, I must say, and there was not a soul there. My queue number was number 1. So it's not a very busy place. But if you do need your test and you are coming by car, that is one way to do it. China's SINOVAC vaccine gets WHO emergency approval. The World Health Organization has approved China's SINOVAC COVID vaccine for emergency use. The WHO said it prevented symptomatic disease in 51% of those vaccinated and prevented severe symptoms and hospitalization in 100% of samples. Some evidence and data gaps are still lacking, though, according to WHO experts. It is the second Chinese vaccine to receive the green light from the World Health Organization after Sinopharm. The approval opens the door for the jab to be used in the COVAX program, which aims to ensure fair access to vaccines. The vaccine, which has already been used in several countries, has been recommended for over 18s with a second dose 2 to 4 weeks later. The emergency approval means the vaccine meets international standards for safety, efficacy, and manufacturing. A study in a Brazilian city saw a 95% drop in COVID deaths after it vaccinated almost all of its adults with SINOVAC. Ceará, in the southeastern Brazilian state of São Paulo, is home to 45,000 residents. Once 75% of its population was vaccinated, the number of cases and hospitalizations fell, according to the study. Brazil has the second deadliest outbreak of COVID-19 infections in the world. It is hoped that the decision to list the Chinese vaccine for emergency use will give a boost to the COVAX initiative, which has been struggling with supply problems. China says it has already produced 10 million doses of COVID vaccine for the COVAX scheme, and that it aims to hit 3 billion doses by the end of the year. As well as China, the vaccine has already been administered in countries including Chile, Brazil, Indonesia, Mexico, Thailand, and Turkey. One of SINOVAC's main advantages, it can be stored in a standard refrigerator at 2 to 8 degrees Celsius. This means SINOVAC is a lot more useful to developing countries which might not be able to store large amounts of vaccine at low temperatures. So basically we have the World Health Organization approval of the SINOVAC vaccine, which has been coming for about the last 2 to 3 months, but there seem to have been issues with data being requested by the World Health Organization and that data being supplied by SINOVAC. So that has been kind of the delay in it. It seems the relevant data was sent and basically the World Health Organization have been pretty happy with what they received. So now they have approved it for emergency use. For people in Thailand, what that means is, well, it kind of gives them more of a sense of ease when it comes to taking it. They know at least that it's been approved by World Health Organization. From the point of view of travel now, it will mean most countries, if not all, will accept the SINOVAC vaccine as proof of being vaccinated. So if you have SINOVAC, you will be able to travel to Europe, the States, and pretty much every other country around the world, because now you do have a World Health Organization approved vaccine. So all positive in that front today. First AstraZeneca vaccine exports from Thailand to the Philippines have been delayed. Delivery to the Philippines of the first batches of promised 17 million doses of AstraZeneca coronavirus vaccine made in Thailand have been delayed by several weeks, a Philippine presidential advisor said on Tuesday. The delay raises questions about AstraZeneca's vaccine distribution plan in Southeast Asia, which depend on 200 million doses made by Siam Bioscience, a company owned by Thailand's king that is making vaccines for the first time. Joey Concepcion, a presidential advisor who has been coordinating vaccine procurement with the Philippine government and private sector, told Reuters that the AstraZeneca had told him the delivery of the first batch of 1.3 million doses would have to be pushed back from the third week of June to mid-July and also reduced to 1.17 million doses. AstraZeneca and Siam Bioscience did not immediately reply to questions about production at the Thai plant. Concepcion said he was in touch daily with AstraZeneca and was told there was delays in Thai production. It is a new plant. They are running. That is how it is often when you start a new plant, he said. The second batch of 1.3 million would also be reduced to 1.17 million and has been moved from July to August delivery. So, as what a lot of people have suspected is, there is delays in CM Bioscience and what vaccines are coming out of it. There seems to be production issues as they've never actually done this before, so it's a new thing for them. So, I mean, I guess if you look at Europe also, they've had the same issues, a lot of production problems, but you think with the mistakes that have been made in Europe that they would have rectified these mistakes by now in other production plants around the world. So it does make you kind of think about the competency behind AstraZeneca right now. I'm not sure the Thai government are still maintaining they're getting 6 million this month. We're only going to have to see what happens there. I'm not 100% sure. It is quite interesting to see if they'll get it or not. But we'll follow up on this story as it breaks. QATAR Airways resumes Phuket flights as holiday getaway reopens to international tourism. Airline will operate 4 weekly flights starting July 1st. QATAR Airways has announced that it marks a significant milestone in the rebound of international leisure travel with the resumption of 4 weekly flights to the famed holiday destination of Phuket, Thailand starting July 1st. In addition to its 12 weekly Bangkok flights, the airline will operate a total of 16 weekly flights to Thailand, providing seamless connectivity for its passengers travelling from Europe, the Middle East and the United States, the airline has said in a statement. As Thailand reopens to holidaymakers from around the world, fully vaccinated travellers will soon be able to visit once again, while also enjoying the award-winning hospitality and services available on QATAR Airways and at its hub, Hamad International Airport, the first and only 5-star COVID-19 safety-rated airport in the Middle East. So I'm not going to read too much more of that statement, but just to remind a lot of people about this. Now, it is great that we're seeing flights open up all around the world, but remember, a lot of countries have restrictions flying from the Middle East. So, for example, if you're coming from the UK, Qatar, Dubai, Abu Dhabi are all red-listed countries, which means you actually have to do hotel quarantine on arrival, even if you transit through them. My own home country, Ireland, it's the very same thing. Even if you transit for an hour or 2 hours, you're deemed to have been in that country and they will make you do hotel quarantine. They are also on a lot of EU country red lists as well. So be very careful when you're booking flights with these airlines. It might be great to be able to get the flight out, but then you might find that on the way back, you're landed in 14 days hotel quarantine and a big, bill at the end of it all that you certainly weren't expecting. So do your research before you're booking flights and make sure that what you're booking is not going to require you to go through a red zone country at the same time. Thanks for tuning in today. If you enjoyed today's episode, don't forget to subscribe and don't forget to leave us a 5-star rating. We are available on YouTube, Apple Podcasts, Spotify, and wherever you like to listen to your podcasts. Thanks for tuning in, and we'll see you tomorrow.